Today, I'm so excited to welcome Dr. Rashmi Roy to the podcast. Dr. Roy is a board certified surgeon, the highest volume thyroid surgeon in the world, and a national leader in the thyroid cancer awareness. She directs thyroid surgical services at the Clayman Thyroid Center in Tampa, Florida, and has performed thousands of thyroid operations. She is passionate about educating women, especially those in midlife, on how to protect their thyroid health, recognize the warning signs of thyroid cancer, and take action early. For midlife women, the thyroid can play an outsized role in how we feel day to day. From energy, mood, and metabolism to hair, skin, and heart health, thyroid function often overlaps with the very symptoms many of us chalk up to hormonal changes. Today, we'll dig into what the thyroid does, how it works in midlife, ways to keep it healthy, what labs to ask your provider for, and the early signs that something may not be working right. We'll also talk about thyroid cancer, how common it really is, what treatment looks like, and what women should know. This is going to be an important conversation for every woman in midlife, not only to understand her risks, but to walk away with simple, practical steps she can take today to protect her thyroid health and possibly save her life. Thank you so much, Dr. Roy, for joining me today.
Thank you. It's a pleasure to be here.
I'm excited because, like I was saying before we hit record, I have not done any conversations on the topic of thyroid. And as in the introduction, there are a lot of symptoms that do overlap, and sometimes it's often a question of, are we jumping to the conclusion that it's perimenopause and menopause and not checking the thyroid? So I think this is going to be a really important conversation for women to
Yeah,
listen
no,
to.
absolutely. It's confused very often and just chalked up to even just getting older. So yeah, I'm excited to get into it.
So can you please start by sharing a little bit about your background and what led you to focus your career so fully on thyroid surgery?
So I always knew that I wanted to be a surgeon. That was I knew that from the get-go. But the question is, what was I going to specialize in? And so when I got introduced to the field of endocrine surgery is really thyroid, parathyroid, and adrenal surgery. I actually did all of it during the first 8 years of my career. And then I began to focus on thyroid surgery for several reasons. One is I just love the pathophysiology of thyroid diseases, and more importantly, the population of that thyroid affects is really young women. It's women in the prime of their lives. They're moms, they're working, they have everything ahead of them, and all of a sudden, something happens and they're diagnosed with a thyroid cancer or they have a thyroid issue, and it really just kind of stops their kind of track. And I knew that I was going to be able to help them.
So for listeners who may not know much about the thyroid, I mean, we hear the word thyroid. We have the phrase check your thyroid very regularly being thrown out there. But can you explain what it is and where it's located, and then also it's important to our health?
Yeah, so the thyroid is a small organ. It's a butterfly-shaped organ that's just kind of right above your collarbone in the middle of your neck. I call the thyroid small but mighty because although it's small, it really controls so much in our body. It's basically like the thermostat for your body. So it's in charge of your energy, your fatigue, your temperature tolerance, your hair, your nails, your weight loss, weight gain. So all of these things are monitored by, your thyroid hormone.
So it's amazing how it is so small and where it's located, and the fact that it does manage so many functions in the human body. So for women, if we want to talk about how thyroid problems can sometimes mimic other health issues, because we did discuss, I did say earlier how sometimes it's chalked up to getting older or to hormonal shifts. What are the other health issues that can be mimicked and looked at, and why is it so important not to overlook this?
So thyroid issues, like I just mentioned, it could be people that they're gaining weight, when all of a sudden, when everything's the same, they're eating the same, they're exercising the same, they're gaining weight. But then people can also think, oh, I'm getting older, I'm perimenopausal, or estrogen deficiencies. So the thyroid can be overlooked because it's chalked up to age or perimenopause. And I don't think that that's fair. You should really be an advocate for yourself, and you should get your thyroid levels checked. Get a full thyroid panel. It's not just your TSH that should be checked. There's a thyroid panel that can really tell you exactly what's going on, with your thyroid health if you just ask your primary care doctor for it.
A surprising thought. So I want to shift into thyroid cancer specifically because that's your niche and that's what you spend your time taking care of. It is one of the fastest growing cancers, especially in women. How common is it and who is most at risk?
So thyroid cancer is really common. It affects both men and women. However, it's the fifth leading cancer in women. And it's growing. So we're finding it more and more often. I don't like to use the word epidemic, but thyroid cancer is becoming an epidemic because we're finding it more. Doctors are more in tune to it, so they're feeling around for it. When they're doing their physical exams, you'll notice your primary care doctors or your OBGYNs are feeling around your neck to feel these lumps and bumps. So the peak, so it's women. So women are 3 times more common than men to get it. And the peak age for thyroid cancer is women 30 to 50 years old. It can happen obviously outside of that, but that's the peak.
And that's pretty much my
Right,
demographic.
exactly.
So, so what makes it tricky to catch early? I've read that it is difficult to catch in the early stages. And why don't blood tests or routine labs usually show it?
So that's the thing about thyroid cancer. It's that most of my patients are completely asymptomatic. So they come into my office and I tell them they have thyroid cancer and they're like, Dr. Roy, how is this possible? I have no symptoms. My lab work has been completely normal. How can I have thyroid cancer? And the fact of the matter is that it doesn't show up in blood work. You can have a neck filled with cancer that is affecting all the lymph nodes in your neck and your thyroid blood work is completely normal. So it doesn't show up in your normal thyroid panel. The tumor marker, there is a tumor marker for thyroid cancer, but that tumor marker is only a marker once you've had the surgery. So your thyroid's been removed. So then you use that tumor marker to see if there's recurrence. But that doesn't help you in diagnosing it. And then symptoms, yes, there are known symptoms for thyroid cancer, but most patients don't have any. If you do have symptoms of thyroid cancer, the most common ones are feeling a lump or bump, or maybe you're clearing your throat a lot when you're not sick. So you notice that you're constantly doing that, or you have like an increased effort of swallowing. But I'll say 90% of my female patients or any patients that come in with thyroid cancer don't have these symptoms. So it's tricky.
So one of the things that you talk about is a simple neck check. It's a 2-minute neck check that you can do at home. Can you kind of explain it especially for people who aren't going to be able to watch on video, the neck check? Can you explain what that is and how that can help women catch the problems early?
Yeah, so a neck check is, if you just think of like a self breast exam, it's a self neck exam. So your thyroid, if you find your collarbone and kind of that sulcus right in the middle where the collarbones meet, if you go 2 finger breadths above that and just in circular motions, you just feel around that area for any lumps and bumps, and then you just want to carry that circular motion out towards your ear essentially, because that is feeling for all the lymph nodes in your neck, because thyroid cancer can spread to lymph nodes. And sometimes people diagnose their thyroid cancer, a lump in the neck, that's on the side of the neck. Unfortunately, that's thyroid cancer that's already spread, but at least you're diagnosing it.
So, because I was thinking about when you were talking about the neck check, our self breast exams have become very common to talk about. And you see the images on social media. Have you done your monthly breast check? Your doctor tells you to do it. I've never once heard about checking your neck.
Exactly. So September is Thyroid Cancer Awareness Month. So I am launching a neck check challenge. It's through my YouTube channel, through my Instagram page, things like that. So it's #neckcheck. So basically you post a picture of yourself doing a neck check. You say #neckcheck. You tag at least 3 of your friends and just spread the word. Spread the word for thyroid cancer awareness. Help other women diagnose it. Because, just add it to your nightly routine. We put lotion on our face, on our neck. As you're doing the lotion, just feel around your neck. You don't have to do it every night, but once a month, at least, feel what your neck feels normal, so that you know what abnormal feels like. So I think, it's just an easy way for women to get to know their body and when to know something is not right.
Yeah, especially since it's such a fast growing cancer that we really don't pay attention to.
So, it's a slow growing cancer once you have it. So I don't want people to be scared, but it's becoming more and more common. So I guess,
Yes,
yeah,
I mean
yeah,
fast
yeah.
in numbers.
So it's
Yes, yes.
becoming
Thanks
more,
for
I don't want to
clarifying
panic
that.
people.
Yes. Yeah. Not like you're going to get it and then like
Right,
3 weeks later you've got
exactly.
massive problems. Yes. Just the numbers of people that are being diagnosed with cancer is a
Exactly,
fast growing
exactly.
number. Yes. So, if we talk about thyroid, autoimmunity, and hormones for a second, many women are diagnosed with Hashimoto's. I've had a lot of clients come to me and say that Hashimoto's is something that they've been diagnosed with, or they're told their thyroid hormones are a little low. When is this actually something that they should keep an eye on versus something to treat immediately?
Yeah, so I find that patients are often confused on what's hypothyroidism and what's Hashimoto's. Are they the same? And so, the fact is that Hashimoto's, it's an autoimmune disease where essentially your body attacks your thyroid gland. And then it produces antibodies that go throughout your body. And so Hashimoto's is the most common cause for hypothyroidism. It's the most common cause for having low thyroid hormone and needing your thyroid hormone replacements like levothyroxine and Synthroid. So, if you're just hypothyroid and you need thyroid medication and you feel well, that's great. You stay on your thyroid medication. And so the same is true for Hashimoto's. 90%, 85 to 90% of patients with Hashimoto's disease, all they need is medical management. They take Synthroid, they take Armour Thyroid, there's many different types of thyroid hormone replacement. They take it and they feel well. But it becomes more of an issue when what I call you're failing medical management. And so you're on the medication. You are doing the right lifestyle changes. You're doing a gluten-free diet, which is the best diet for Hashimoto's, but you feel awful. Or you are on thyroid medication and your numbers are good, but you still feel awful. So those are two categories of patients that essentially have failed medical management, and you need to take it a step further, and that step further is surgery. But as scary as that may sound for some patients, surgery is super beneficial for those groups of patients, and my Hashimoto's patients are some of my most grateful patients because they get their quality of life back. It can be a very devastating disease for patients that, the medication isn't working.
Yeah. Well, and my days of retail pharmacy are behind me for a long time now, but I know getting someone situated on a thyroid dose can be tricky. And then there might be a switch in a generic manufacturer, or lifestyle changes happen, age happens. And so it is sometimes a constantly moving target. But when all medical treatments fail, then knowing that surgery is an option and their quality of life improves is it's really probably very promising for people who are diagnosed with Hashimoto's.
Yeah, I mean, these women come into my office, and I know as soon as they walk in that they're going to benefit, because all I have to say is, tell me how you're feeling. I mean, these women break down because they can't play with their kids. Sometimes they have to quit their jobs. I mean, their life is completely destroyed by this disease.
And so when we're talking about having symptoms and lifestyle changes, what are some ways that women can be proactive in their lifestyle adjustments to support their thyroid health?
Yeah, so obviously eating healthy. So the best diet, like I mentioned, for Hashimoto's patients is a gluten-free diet. It's hard to do, but that really is the best diet. There's also something called anti-inflammatory diets. So you can Google that, those anti-inflammatory diets. Some supplements that are really good for thyroid. Selenium is a really good supplement. And just exercise, and obviously doing everything in moderation, doing everything you can to limit the stress on your body that is in our environment.
And we talked about, as far as taking care of our thyroid, we talked about the neck check, which I'm going to actually start doing that when I go tonight. When I wash my face, I'm going to give myself a minute and I'm going to do my neck check. I'll share it and
Please
I'll post
do.
it, because I think that's really important, especially knowing that your blood work may not show that you possibly have a thyroid cancer. That just seems like something that we could all take care
Right.
of, and like you said, know your body. I think that there's a lot of times we get busy and we don't think about it, or we don't pay attention to ourselves because we're busy with the family and everything else going on, that's something we overlook. So that's definitely something that I'm going to go home. I'm going to go tonight. I'm going to definitely do it. But if you don't have symptoms and you're not even sure what your thyroid levels are or if it's a normal functioning thyroid, how often should we approach our doctors and at what age? Is there a recommendation for that?
So no, there isn't. And so that's, I'm kind of
Okay.
trying to champion this whole protocol. So along with doing your neck checks, I think every woman at the age of 30, at least, should ask their doctor for a thyroid ultrasound. Because if your thyroid cancer isn't showing up in blood work, if you're asymptomatic, how are we going to know if you have a thyroid nodule and if you need further intervention? I think everyone should get get an ultrasound. If your thyroid looks great at 30, then maybe in 5 years get another one. You don't necessarily need to get an annual ultrasound like you do with like a mammogram if your ultrasound is okay. But if you haven't had one at any age, 30, 40, 50, ask your primary care doctor for one. I'm really trying to promote screening and self neck checks to try to find thyroid cancer early if someone has it.
If we're talking about annual thyroid screenings, should every woman be kind of pushing that? And I know you said you're trying to make the movement of kind of making it more standard of
Right.
care. Would it be if you're say 40, 45, would it be out of touch to ask for an annual ultrasound, just like a
So,
mammogram?
like I said, I don't think you need it annually, but I think you at least need, you
Okay.
at least need a baseline. If you don't have nodules, then you can go several years without it. If you do have a nodule, then yes, you need to monitor it on a yearly basis. And so all of this is coming from actual data. So I did in 2022, I started a free thyroid screening program in Tampa where I basically went around to different companies. I took my team, mobile ultrasounds, and screened women, just did a quick ultrasound on women that had no thyroid history. And what I found was the detection rate for thyroid cancer is so astronomically high when compared to mammograms and pap smears. So mammograms and pap smears, their detection rate for finding a cancer is 0.5 to 1%. Of the women that I screened, my detection rate was 2.4%. So 2.4% doesn't seem high, but when you compare it to what has been standardized for other cancers, it's pretty high.
Yeah.
These women had no idea they had a nodule, and so by the screening program, that we found a nodule, we biopsied it, they went to surgery, they had a thyroid cancer, they're cured. They're cured by me just taking out half their thyroid, and maybe they don't even need medication afterwards. So that's where kind of this all started from. It's not just coming out of nowhere, it's actual evidence that shows that screening really is preventative medicine.
And so when you're talking about removing the thyroid or part of the thyroid, I mean, do you see frequently that you're able to catch it early enough that you can just remove part of the
Yeah,
thyroid?
absolutely. In my study that I did, every patient was cured with just removing half the thyroid gland. So once half the thyroid is removed, and we do pathology in the operating room to make sure that they're cured by just removing half. If we need to go further, we're able to do that at our center. If I just remove half, 50% of patients may not even need medication. So I don't start you on it right away. You get blood work checked about 6 weeks later, and that determines if you're good or if you need a supplement. And if you need a supplement, I don't expect you to miss a step. You should feel the same exact way that you feel right now. It's just that you need a pill every day.
Yeah, that's interesting. And so how many cases how many operations do you do on average a year? I'm just trying to think of the numbers of women or patients, men and women, that are having cancers or need to have their thyroid
So
removed.
yeah, so I probably do, one of the most in the country. So I do about 600 thyroid surgeries a year. And at our institute, so at the Hospital for Endocrine Surgery in Tampa, we have 5 thyroid surgeons. And so between all of us, we do over 2,000 thyroid operations a year.
Wow.
Now I'm not saying they're all for thyroid cancer. There's other reasons. There's
Yes.
Graves' disease, Hashimoto's, goiters, things like that. But the majority of patients do have thyroid cancer.
And that's a pretty big number, period, of having those kind of surgeries. And it's not an injury related kind
Right.
of surgery where that you're fixing something that was
Exactly.
broken.
Exactly.
Wow. And it's interesting to me because I have spent so much time in the space talking about the other hormones. And so spent a lot of time talking about estrogen and progesterone and testosterone and but the thyroid hormone, but the thyroid gland really does control so many things, and I feel like it's so
Yeah,
neglected.
it's overlooked, um,
Hmm.
and part of, yes, thyroid cancer awareness, but also thyroid health awareness. It's so important for women, men too, but more important for women, just for our overall health. Making sure your thyroid is in check, along with your other hormones. You can still do the hormone replacement therapy for the estrogen and progesterone and things like that. But if your thyroid's not in check, and you're still not going to feel well. So, you need to just make sure you're checking the full body.
Yeah. So if listeners were to take one message away from our conversation today, what would that be for you?
So be an advocate for yourself. You're in charge of your body, you're in charge of your health, you're in charge of your future. Do your self neck checks and ask for an ultrasound. So those are, I think, the two most important things, because if you don't diagnose it, you're not going to know. So, self neck checks, screening, early detection is early cure. And it's just hopefully just a bump in the road, and you live the rest of your life, knowing that you've done everything you could for yourself.
Yeah, I think that one of the things I'm going to take away from this is, yes, it's important to have your thyroid hormone levels checked, but that doesn't necessarily, it shouldn't stop
Mm-hmm.
there. And that an ultrasound should be something that we're starting to look at with our physicians, and also making sure we're doing our
Yep.
neck checks. So I will start the listeners with the neck checks.
Perfect.
Yes. And I really appreciate you coming on and sharing this with us because, like I said, I do think it's overlooked and can be a neglected body part. And for the women that I know who have had issues with their thyroid levels, it just seems very like blase, like, oh, yeah, I just got my thyroid checked, my thyroid's low, or oh, yeah, and I've had friends that have had surgery and had part of their thyroid removed, and it just kind of, it didn't feel like, it almost feels like an appendix or something, but it really does, it does manage so many things
It's
in the
you know,
body.
and then once you start hearing about it, or paying attention to it, you're going to notice more patients who have Hashimoto's, more patients that have thyroid nodules, goiters, thyroid cancer, things like that. Um, it's just, being in tune to it, and knowing it's such an important part of your body that you need to pay attention to it.
Yeah, and we're a whole body. We're not just a
Right.
hot flash and ovaries. There's more to us than that. So, thank you again for coming on and having this conversation with me. And I will make sure to have in the show notes how to find you. We'll talk about the thyroid, the neck check, and make sure that that's in the show notes as well. And thank you for the work that you're doing and continuing to do to spread
Oh,
awareness.
thank you so much. It's a passion, and it's an honor to be on your show. So thank you so much.